Hello guys, today I'm going to make a quick video about cardiac tamponade and Pulsus paradox. What is Pulsus paradox? Is when a person inspires, usually the blood pressure decreases, but it is very slightly. But when it comes to Pulsus paradox, the blood pressure decreases more than 10 milligrams, not 100, 10 milligrams. And that is basically it. So to know about Pulsus paradox, you should know one important cause of Pulsus paradox, and that is cardiac tamponade. So in a normal person's heart, let's say this is the heart, and these are the four chambers. There is a layer known as the pericardium surrounding it. So usually what happens is when the is systole, the heart muscle contracts, and when there's diastole, the heart muscle relaxes. And this pericardial layer is unable to stretch, unlike the heart muscle. So when there is fluid in this pericardial layer, let's say this is the fluid. When there is fluid in the pericardial layer, this will make it difficult for the heart muscle to stretch because this pericardial layer is unable to stretch as well. So because of that, during diastole, when the ventricles fill, the ventricles don't fill up to the full capacity. So let's say a normal heart muscle's ventricles can fill up to 100 milliliters. But when it comes to fluid in the pericardium, it can only fill to about 50 milliliters. Why? Because these ventricles are unable to stretch. So since the fluid is equally distributed in all these layers, all these throughout the pericardium, this will make the pressure in all four chambers equal. Okay, so that is basically the pathology that happens when it comes to cardiac tamponade. So here is what I have written. So normally in systole the heart contracts, diastole it relaxes. Surrounding heart is a pericardial sac which can't stretch, unlike the heart muscle. So when there is fluid in this sac, it makes the ventricles unable to fill in diastole, and the room in both ventricles decreases. So end diastolic volume decreases. So stroke volume decreases. So since the sac surrounds the heart equally, this will cause the pressure in all chambers to become equal. So here's an example of heart surrounded by pericardium. So why in inspiration the drop is much more severe when it comes to cardiac tamponade? So in inspiration, these are the lungs. So in inspiration, you get air into the lungs. So the lungs will become much more expanded. Okay. So this will cause the blood in the veins, which are usually behind the lungs, behind the lungs, to be squeezed into the heart. Okay. So this is the heart. Okay. To be squeezed into the heart. So this will cause the, I'll draw an arrow. This will cause the atrium in the right side to enlarge along with the ventricle, and it will make the left side ventricle space smaller because of this sudden increase in pressure. Okay, so let's say before inspiration the heart is like this. After inspiration the heart is like this, because the right ventricle has expanded full of blood, because blood has come and collected into the right atrium and right ventricle because of the increased pressure. So in tamponade, the right ventricle's pressure as well as the left ventricle pressure is all, I mean, not the pressure, the left ventricle size is already quite small. It's unable to expand. So as a result, since the ventricles in both the right and the left are small, and the left ventricle becomes even more smaller during inspiration, the fall in blood pressure is much, much more higher when it comes to cardiac tamponade. So therefore, the fall in blood pressure is much, much more higher because in the left ventricle, in cardiac tamponade is much more small, and then after inspiration, it becomes even more smaller. So as a result, the diastolic volume, the end diastolic volume in the left ventricle decreases, and as a result, the stroke volume in the left ventricle further decreases in cardiac tamponade. So as a result, the cardiac output and the blood pressure decreases. So that is basically it for Pulsus paradox. Hope you guys understood it. Okay, bye.